From an operational perspective, the new system as a whole has reduced possibly some resources from having to attend 999 calls and divert them to local A&E departments, as well as the local surgeries where needed. And likewise, from the pathways side, we've had a lot of out-of-hours calls, which have gone from out-of-hours to needing an ambulance. So it's more appropriate care for when it's needed. Well, as far as coming in from an out-of-hours perspective, they'll come in, and if an ambulance is required, before with other services, they'd have to transfer that on to an ambulance service. With us, we can move that call straight to the dispatcher, straight to an ambulance. So there's no kind of transition from one system to another. It's a unified process which is carried on throughout. I think the pathways clinicians are essential within here. If, for instance, we have any queries or problems whatsoever with the symptoms or particular course of action that's required, we can instantly just go straight to a clinician for that backup and that safety net. I think it's better. I think that the patient, as an end user, may feel like we're more human now, whereas before I think a lot of the questions were mandatory. We were looking for yes or no answers, and it was kind of gone that way, where now we probe, we ask more questions about exactly what they've been up to, how that can affect other things, and it allows us to delve in a lot more further, and it feels like they're getting a bespoke treatment. Whereas before, I think there was less avenues to go down. If they had a specific problem, they would get one of only a couple, where now we're open up to GPs, nurses, district nursing teams, pharmacists, as well as all the regular stuff such as out-of-hours GPs and ambulances. So now, if somebody phoned up with a particular condition that needed a nurse, we can now arrange that. With my relatives, if I've got anybody who's sick or anything like that, I say, especially with the older generation, they tend to leave things, not go to a doctor. I definitely say to phone up 111, get in contact, see if it's worthwhile doing anything about, because a lot of people don't know what they need to do to go, and see if one of the call takers will be able to tell them if they need to go and see a doctor, because it may be they can speak to a clinician, they can stay at home, get some home management advice, and treat it from there.